So I decided to do a mind map of the pathologies. I found this to be the best way for me to memorize what I'm learning. I like to break things up into different parts and list what I know into bullet points. It just helps me focus on each bullet point separately, and then I can gather all of that information. And yeah, it just helps me pay attention to things better that way. So I did a hepatic adenoma. All of this goes together. So to start, it's a rare benign epithelial neoplasms that are composed of normal or slightly atypical hepatocytes. Occasionally, they contain fat through Kupffer cells, and bile ducts are usually absent. Often solitary, but can be multiple, especially in patients with glycogen storage disease or von Guericke. The tumors are partially or completely encapsulated and have well-defined margins. They're located in the subcapsular region and vary in size from 6 to 30 centimeters. Internal hemorrhage or necrosis occur in about half of the lesions, and areas of bile stasis may be seen. More common in females than males, and the use of oral contraceptives have been considered a predisposing factor, and the tumors have low malignant potential. Clinical findings: the majority of patients are asymptomatic. However, they may present with right upper quadrant mass, hepatomegaly, or right upper quadrant pain from internal hemorrhage within the adenoma, or a hemoperitoneum secondary to the rupture of an adenoma. Sonographic characteristics: varied nonspecific appearance, may be hypoechoic, particularly in patients with glycogen storage disease. This is because the liver is usually more echogenic due to fatty infiltration. Irregular hypoechoic mass within the hypoechoic areas within the mass reflect internal hemorrhage or necrosis, and then a hypoechoic halo may be visualized around the mass. And then the differential diagnosis are going to be diagnoses that have similar symptoms or characteristics, and then those are focal nodular hypoplasia, cavernous hemangioma, hematoma, abscess, primary or secondary malignant neoplasms, or focal fatty infiltration. And then the two examples here. This is a transverse sonogram of the liver, demonstrates a solid echogenic mass there. And then this example is a transverse sonogram that shows a well-defined echogenic mass with a hypoechoic halo there. And then that halo is right there. And then the next one that I did is cavernous hemangioma. Cavernous hemangioma is the most common benign neoplasms of the liver, composed of blood vessels, but blood flow is typically not detected within the mass due to the flow within the vessels being exceedingly slow. More common in females and occur most frequently in old age. During pregnancy, they may enlarge due to hormonal changes. More common in the right lobe, especially in the posterior segment. They are often solitary and small, but there could be multiple or become large enough to occupy the entire liver. Clinical findings: the majority are asymptomatic. A small percent may bleed, causing right upper quadrant pain. Some patients may present with an enlarged liver, abdominal bruise, or thrombocytopenia, which is low platelet count. And then sonographic characteristics: homogeneous hyperechoic mass, usually less than 3 centimeters. Generally round and posterior enhancement may be seen. While most lesions are echogenic, they may appear hypoechoic or complex. And then the differential diagnosis: an adenoma, focal nodular hypoplasia, hepatocellular carcinoma, metastasis, hematoma, abscess, lipoma, or focal fatty infiltration. And then the two examples I have. This is a transverse sonogram that shows a hypoechoic mass with homogeneous echoes. And then this example is a transverse sonogram that shows a hyperechoic lesion with heterogeneous internal echoes. And that's all I have.